Before this video starts, just want to heads up that my phone is running out of storage, so the video keeps cutting in and out. So just assume that the video is continuing, okay?
Ready. So we are going to be inserting a Foley catheter today. So in this scenario, I have already looked at the order, I've already noted what patient it's going to be and all that. I've already brought the supplies into the room. And we're gonna start this scenario as I've already checked the patient, I've already asked when they've used the bathroom, I have checked if they are okay with me inserting a Foley catheter, and we have already done peri-care on the patient prior to inserting the Foley. So, let's go. I would knock, say, okay, I'm back, are you ready to get that Foley inserted? They'd say yes. I'd say, okay, I'm gonna pull down your blanket, we're gonna lift your gown up. We would remove anything that could get in the patient's way, such as this. I'm gonna raise the bed up. Okay, we're gonna raise the bed up to a waist height. This patient is a female patient. The patient has already given consent. I have done peri-care. And so we have to have it a waist height, that way we don't break the sterile fill. My sterile fill just will be right here when I open it. And we use used materials, so the materials are already open, but in this scenario you would check to make sure their expiration date's correct, it's not open, and you would make sure that all materials are in there, which is what we've already done. And that seems fine. Okay, and due to it being a mannequin, we have this fake loop, so we're just gonna say that this is in there. So we're good. So I'm gonna open it. You can't go below your waist, so we would just drop, even though I haven't had my sterile gloves on. I'm gonna open it with the 1 inch. The 1 inch. I'm gonna move this over here real quick. We're gonna go the 1 inch. The 1 inch. I'm gonna grab my sterile gloves. I'm gonna set those right there. I'm gonna grab this. This is technically not considered sterile. It's gonna go shiny side down. This is gonna go underneath the patient to make sure that we do not wet the bed. We're gonna lift her leg up. And because it's a female patient, I'm gonna put her in the frog leg position. And normally your patient can talk back to you and explain things to you, so you would just lift it up. And we're gonna tell her to go back into the frog leg, and that just gives me a better view. So, I am going to open this up. This part is not sterile. You can open up however you need to. This outside part is not sterile. On the outside of my sterile field, because my sterile field's right there, I would open this up. Make sure I'm only touching the 1 inch border. And when you open this, you want to open it enough that you are not going to contaminate your gloves again. There, like so. So then you're gonna grab the first, which is gonna be my dominant. I'm gonna grab it. This is to my waist, if you cannot tell, I'm very short. We're gonna grab the next one. Put that on. And that curtain will not be in my way. Now to make sure I don't go below my waist, we're just gonna go like that. Perfect! So this is considered sterile. We're prepping my sterile field. I am going to place this like so. That way you can still see the female's vagina. I am going to lift this up because this is all sterile. I'm going to move this box. I'm going to prep. Now, like I stated, this was technically in here. It would be technically poured right there. So we're just gonna say that it's already poured. I am going to prep my tubing because I like to prep it beforehand. You would video cut out, but we're moving on. We're gonna commit a hand. We're gonna clean her. We're gonna go down. Put it. We're gonna go down. Put it. Normally you could drop it, but if I'm tossing it to the side so it's not in the sterile fold, we're good. We're gonna go down the middle. There we go. Now with your lube, like we said, this is like the not actual lube. This is not what it looks like. You're already committed. you are gonna go in. You're gonna push until you see urine, which is normally not far. It's not long. After you see urine, we're still in sterile field. We go in 2 to 3 more centimeters. After we hit there and we know we're not going any further, you can use your hand right there just to hold it so it doesn't fall out, because this takes a lot of pressure. Pull, and it should not fall out. And then you just lift this up. Your sterile field is no longer needing to be sterile because you are done. You would get a stat lock, although I'm not putting a stat lock on a mannequin. You would hang the bag. If you need to get a urine sample, you would get it through right here. Urine would already be draining. You don't want to get it from the bag. Any questions?
What would you chart?
You would chart how the patient tolerated it, the amount of return, what the amount looked like, if it had an odor, if patient's complaining of any burning. You would chart the education you gave the patient about the Foley. I don't think I'm missing anything else. I think that's it.
So after you insert the Foley, you are going to ask the patient if they need anything. They're probably going to say no or take it out. You're gonna give them their collet. You're gonna lower the bed to the lowest position, and then you're gonna hand hygiene out. Thanks.